chance for a shower. It's 8:48. Here's Jessica.
All right, Katie, thanks. Listen to these numbers. Did you know that 70 to 80% of all doctor visits are directly related to stress? Pretty crazy, right? That's according to the U.S. Department of Health and Human Services. But the thing is, we all get stressed, whether it be from jobs, family, relationships. So what do you do about it? We have health and wellness expert here, Nuesse, to talk more about the deadly effects of stress. Good morning.
Good morning.
Thanks so much for coming in.
Thank you.
This is such a good topic to talk about. We all get stressed here. Why is it deadly?
Stress is actually deadly, or can be deadly, because of how it affects your hormones. It throws off your hormone balance in your body. So the human body is designed to deal with short-term stress, something like a saber-toothed tiger jumping out and attacking you. This is thousands of years ago when the body was first designed. Today we have stress in the form of, like you said, money, relationships, job, etc., etc. So we're under constant stress, and the stress signals the body to produce hormones. In short term, they're great, but in large doses, these hormones are directly related to anything from digestive problems, sleep disturbances, all the way up to heart attacks, strokes, some forms of cancer, and even things like acne and difficulty losing weight. So it can be very destructive.
Yeah, is it emotional, or is it something, or is it mental? How do you handle something like that?
Obviously it's an emotional response to a stimulus, whatever the stressful stimulus is, but it's a chemical response. Your body responds to it chemically, so it starts producing hormones. Your adrenal gland produces hormones and dumps these hormones into the blood. And again, in short term, they're great. They help you deal with the wild animal attack, but that's not a reality for today. Today, we're dealing with stress on a much higher level.
See, the thing is, sometimes I always feel like you can't control it. Like, it could be during the holidays, it could be going through relationships, anything like that, and then it's just something that happens. How do you kind of combat those stress effects, those stressors that you have?
Yeah, there are things that you can do, and again, there's some stress that you just have to deal with. Short-term stress is okay. If you're under stress all of the time, a lot of people's jobs are very stressful, so we're dealing with stress a lot. Exercise is the big one. Getting, it doesn't mean an hour and a half in the gym every day, but getting a regular amount of exercise, avoiding caffeine, which is
that's a tough one.
So that, and then if you feel like you're having any of the symptoms that I listed, or you're having any health problems, get yourself screened. The screening is easy to do. We do it in our clinic absolutely free to anybody that wants it. All you have to do is contact us, get the screening done. It's much easier to catch these problems early before they become life-threatening.
Right, or you can get those heart problems and all those issues you just talked about.
Absolutely.
Speaking of testing someone for stress, we're going to bring Dan in here. We're going to give him a little stress test here. Talk about what we have here.
I love that I'm the guinea pig for everything.
You're good at it. You're good at it. Okay.
He's going to need a chair, first off.
Oh, he's going to need a chair.
He's going to need a chair.
Okay.
I don't know.
So while he grabs a chair, we're going to let people know about the event you're having tomorrow night. Right?
Yep.
At the Mount Washington.
Mount Washington Recreation Center.
Recreation Center, 6:30 to 7:30, and it's a free event where people can learn about the deadly effects of
Absolutely, yes. It's an hour-long workshop, so it's interactive. Depending on what the audience concerns are, I kind of tailor the talk to that. So.
That's perfect. Okay.
Don't get nervous for the gun
Let's
show.
see if he's stressed.
Do you feel nice and calm and relaxed?
I think so.
Oh, we'll see.
So we're gonna do what we're gonna do is
different chairs.
So what I'm gonna do is he's gonna be sitting down. I'm gonna take his blood pressure.
All right.
Then he's gonna stand. I'm gonna immediately take his blood pressure again. Now this is part of the screen that I do in my office.
Okay.
What I'm expecting is that when he stands up, his blood pressure goes up a little bit. The reason this happens is because his adrenal glands fire, dump hormones into the blood, raises blood pressure because when he stands up, gravity pulls blood away from his brain, so he doesn't get dizzy. His blood pressure rises.
Okay.
If it doesn't, we're gonna suspect.
Okay.
That he's stressed, basically.
Well, he just drank. Just so you know, he had a couple cups of coffee this morning. Will that affect the stress test?
It could affect his blood pressure, but whether his blood pressure is high, it should rise regardless. So I might get that his blood pressure is high, but that would be a completely separate issue.
I will tell you, I do not feel stressed. I love my job. I like the weekends.
We'll see.
I'm going on vacation.
So how many people do you get that say that they don't feel stressed and they might get those results if they are stressed? Not that you're
a lot. I mean, it's in the 50% of what I'm doing. Yeah, it's very prevalent.
But as you said, too, environmental factors as you go and
let's see this.
It's just life, right? I mean, we're all worried. Okay.
Yeah, unfortunately it is.
Stressed right now?
I am going to have to listen.
Yeah, go ahead. Sorry.
This is very interesting. No caffeine, exercise, Okay, we have about a minute left to see if Dan is, how stressed Dan is.
Okay.
We're being very quiet here. He's testing. How are you feeling, Dan? You're sweating a little. I know. Being nervous. Okay. So what is it? What are you looking at?
So it's on the high side.
Is it?
A little bit.
Wow.
Go ahead. Now stand up. I'm gonna do it immediately again.
Okay. Okay. All right. We might have to finish this during the break, and we'll give the results afterwards. Again, his event tomorrow at the Mount Washington Rec Center at 6:30 to 7:30, and it's free to learn about the deadly effects of stress. What do you get? Let me see if he has it.
We should talk on the break.
Oh, that doesn't sound too good. We'll see you guys after the break.